Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is diseases of nasal septum. We divided our lecture of nasal septum into 5 sections. In the first section, we will talk about the basic anatomy of the nasal septum and what are the different fractures that can occur in the nasal septum area. So in this section specifically, we will talk about the Kiesselbach's plexus, and then etiopathogenesis and different types, treatment and complications of the fractures. Then in the second section, we will talk about deviated nasal septum, DNS. It's also known as DNS, deviated nasal septum. And what's the etiology? What are the different types of DNS or deviated nasal septum and how we can treat and what are the clinical features of DNS? Then in the third section, we will talk about the septal hematoma. Hematoma is the collection of the blood. So it's septal hematoma, so collection of blood in the septum. How it presents, what are the clinical features of septal hematoma, how we treat the septal hematoma, and what are the complications of septal hematoma. Then in the fourth section, we will talk about the septal abscess. So one was the hematoma, in which there is collection of blood. Then in the abscess, there is collection of the pus in the septal region. We will talk about what are the clinical features of septal abscess and what are the treatment options and complications of the septal abscess. Then in the fifth and final section, we will talk about the septal perforation. What are the causes of septal perforation? What are some clinical features of septal perforation and what's the treatment of septal perforation? So all this will be covered in our today's lecture topic, which is basically limited to diseases of the nasal septum, which is the portion which divides the nose into two halves, into two nostrils. So septum is this middle portion that divides the nose into two halves. So all the diseases of the nasal septum will be discussed in our today's lecture topic, diseases of nasal septum. So to learn more about this topic, keep watching sqadia.com.